What is the cause of low back pain in women? The cause of low back pain in women is foremost the spondylosis, spondylitis, spondylolisthesis, and then if there is a uterine problem, certain time there is a radiating low back pain, and if there is a renal kidney problem, that pain also leads to low back pain. So we must rule out what exactly. In women, there is a possibility of osteoporosis or bone deficiency or vitamin D deficiency or calcium deficiency leads to spondylosis in above 35 to 40 age. When there is a injury say, to the neck or back, there is a possibility of spondylitis, there is a possibility of infections in the joint, there is a possibility of immunological disorder like rheumatoid arthritis, and then any other specific or non-specific arthritis leads to joint pains that does cause the spondylitis. The obese woman where there is a injury to the low back, in that condition the vertebral bodies will be displaced from one joint to another joint in L4, L5 or L5S1 levels. Such the displacement of the vertebra over the vertebra in forward space called as a listhesis or spondylolisthesis. And then there is a porosis, and then there is a listhesis, and there is a spondylosis. Apart from that, when there is a abdominal infections like pelvic infections, uterine infections does cause the radiating pain to the back. Even the post delivery, there is a pelvis variability causes the pain in the back. And then there is a stones in the kidney, and there is a infections in the kidney, there is a bleeding in the kidney, does cause the radiating pain to the back. These are the various pains we see it in women where we should be handle it. In back pain, most of the people in obese people, due to rupture to the disc, disc is between the two vertebral body which act like a shock absorber. When this shock absorber or a disc is burst open, then the disc material inside is like a jelly material will protrude out back onto the spinal cord, causes the pressure on the spinal cord, leads to the low back pain. And then there is a wedge compression fractures in the vertebral body also causes the pain in the woman. And then there is a possibility of tumors in the spinal cord, possibility of tumors in the bones, possibility of Cox infection like tuberculosis infection in the low back pain does leads to the pain. So these are the various causes for the pain which we need to rule out with X-ray, MRI, CT scans, and if necessary certain blood tests to rule out what type of pain in the low back area. Once you come to a conclusion that the diagnosis is appropriate, then you should treat the patient accordingly so that the pain could be controlled. So the 5 problems in the woman is the most important. These causes to be ruled out with a proper clinical diagnosis as well as the diagnostic documents, so that the appropriate treatment can be implemented from our side to treat the patient.